Alright, so today I'm going to be administering medication via injection. So the first thing I'm going to do is avoid distractions. I'm going to check my medication. I check the date, the patient name, the drug name and dosage, time for administration, and route of administration. I check the patient's chart for allergies and anything that could make me want to hold the medication. I'm going to then identify expected outcomes, identify what teaching I might need to do to the patient. I will then gather my equipment. I'll make sure I have the proper syringe and needle. I'll make sure I have my alcohol swabs and gauze along with my gloves. I will then perform hand hygiene and state the 6 rights of medication administration, which are right route, right dose, right time, right medication, right patient, right documentation. I'll check the expiration date, make sure the medication is not expired. And this will be my first check. My second check, I will compare the MAR to label on the medication container, verifying correct medication. I will verbalize that I will calculate the correct amount of the drug to be given. I will prepare medication in the syringe. Visually inspect the medication for color, clarity, sediment. And then I will inject air into the vial in quantity of desired volume to be drawn into the syringe. I will withdraw the correct dose. Recap the syringe using the scoop method for transport to patient's room. If not administered immediately, clearly label the syringe. I will then check the label of the vial, ampule, or pre-filled syringe compared to the MAR. That's the third check. Check the expiration date. Carry the prepared medication, vial, gauze, alcohol swab, and MAR to the patient's room. Upon entering the patient's room, I will perform hand hygiene. I will be aware of my spatial safety. I will identify myself. I will identify the patient. I will check to make sure that they don't have any allergies. I will ensure privacy, explain what is about to occur and what medications will be administered, allow for patient questions, raise the bed to a comfortable working height, don my gloves, scan the patient's wristband, scan the medication, correctly record the medication on MAR, injection site, any pertinent collected data such as pain level, blood pressure, pulse, medication given and dose, time and route. I'll record all that. I will prepare the site for injection, whether that be intramuscular or subcutaneous. I will clean the site with alcohol swab in a circular motion from the center of the site outward. I will allow the alcohol to dry. I will place the gauze pad on the patient with the corner aimed at indented injection site. Then I will administer the injection. I will hold the syringe between my thumb and forefinger as if grasping a dart, and then inject it based on wherever I want to inject it, whether that be intramuscular or subcutaneous. It varies. For subcutaneous, I pinch the cleansed skin with non-dominant hand. I insert the needle quickly and firmly at a 90-degree angle and release the skin. I can't do that while holding, and I can only use one hand. Do not aspirate with dominant hand. Inject medication slowly but continuously, and then I will withdraw quickly while gently placing the gauze pad over the site of injection. And it is important to know not to rub the injection site. For intramuscular, I will again identify the proper location, and for this we displace the skin in the Z-track method. I will once again position the syringe at a 90-degree angle, skin to surface, insert the needle to skin quickly and firmly at a 90-degree angle, aspirate for 5 seconds, and then with my dominant hand, inject medication slowly and continuously. Wait 10 seconds, withdraw at a 90-degree angle just like I went in, release the skin, and then immediately cover the injection site with the gauze pad, applying gentle pressure, and examine for active bleeding or bruising. When discarding the used syringe, I will engage safety engage safety device if available. Never recap a used needle that's dangerous and place in sharps container. And prior to leaving the room, I will dispose of my gloves, the alcohol swabs, and gauze pad. I will lower the patient's bed, raise the rails, give them their call light, and make sure all their belongings are within reach. And that is it. So that is how you perform the IM/SQ injections. Thanks for watching.